Hello, I'm Charles Rudin, Chief of the Thoracic Oncology Service at Memorial Sloan Kettering Cancer Center in New York City. I specialize in the treatment of lung cancers. In this video, I'll provide an overview of immune checkpoint inhibitors, a form of immunotherapy for the treatment of lung cancer. The immune system has safety mechanisms that are designed to suppress the immune response when necessary. These mechanisms are called immune checkpoint pathways and minimize damage to healthy tissues when utilized at the appropriate time. When the immune system recognizes a healthy cell, it is suppressed. However, when the immune system recognizes foreign cells, it becomes activated and can destroy them. The challenge is that cancer cells are able to adapt these immune checkpoint pathways to avoid detection and lessen the immune response. This allows cancer cells to thrive. In order to combat these cancer cells, researchers are studying a therapy called immune checkpoint inhibitors. So let's review how immune checkpoint inhibitors work. As their name implies, immune checkpoint inhibitors work by targeting the immune checkpoint pathway of the immune system, essentially the brakes on the system. Their goal is to keep the immune system from suppressing itself so that the body's own anti-cancer response works better. Currently, drugs are being developed most actively against a few specific targets: PD-1 or PD-L1 and CTLA-4. With over 7,000 research slots designated for lung cancer patients. Infusion time and schedules may vary depending on the drug. Immune checkpoint inhibitors are generally given intravenously over 30 to 90 minutes. They are generally given every 2 to 4 weeks until confirmed disease progression or until the clinical research study ends. When looking at how long it takes to see results from therapy with anti-PD-1 and similar drugs, of the patients who respond, about half of them have seen their tumors respond in 6 to 8 weeks. The other half may take a much longer time, possibly as long as 6 months. One phenomenon to be aware of is known as pseudo progression. In a small subset of patients, the tumors on a scan may seem to get worse at first and then get better, or there may be new areas of tumor. One possibility is that the tumors look like they're getting larger because a large number of the patient's immune system cells move into the tumor, and as they go, the tumor gets smaller again. So some tumors that look larger on X-ray and scans might be larger because the immune system is attacking the cancer, not because the cancer cells are growing. Several side effects have been observed in clinical studies. The most common side effects reported include diarrhea, fatigue, rash, and itching of the skin. An infusion site reaction may also occur sometimes, as is also the case with chemotherapy. There currently is no easy way to predict who will and who won't get these side effects. About half of patients develop some inflammation-related side effects. These are usually easy to manage, but may require additional medications and sometimes can be very serious. A side effect seen with some immune checkpoint inhibitors in lung cancer is pneumonitis, or an inflammation of the lungs, which may lead to difficulty breathing if not treated early and correctly. Some other side effects that are inflammation-related and may be triggered by turning on the immune system include diarrhea, arthritis, colitis or inflammation of the colon, and abnormal function of certain endocrine glands. It's important to let your doctor or nurse know if you are experiencing any problems while on treatment so that they can sort out whether the side effects are related to treatment or not. In most patients, though, based on what has been seen in clinical research studies to date, these kinds of treatments are well tolerated. Now let's discuss whether immune checkpoint inhibitors are a treatment option for you. Immune checkpoint inhibitors are being studied in patients with different stages of lung cancer. They're being studied as standalone therapy, and in combination with targeted therapy, radiation therapy, chemotherapy, and other checkpoint antibodies. Eligibility will vary by research study, but the following are some things to consider. If you've never been treated before, you are looking for a first-line clinical trial. If you have had a prior chemotherapy for metastatic disease, you may be looking for a second-line clinical trial. If you've had multiple lines of therapy, you want a clinical trial that allows that. Ask your oncologist about clinical research studies available nearby, call, or search the Longevity Emerging Med Clinical Trial Matching Service at www.longevity.org or go online to www.clinicaltrials.gov. This concludes our overview of the immune checkpoint inhibitors. I hope you found this information useful. For additional information about the immune system and immune checkpoint inhibitors, please visit the Longevity website at www.longevity.org.